This lecture is on pancreatic hormones. So we are talking about the parts of the pancreas that are called the islets of Langerhans. So these now are the endocrine portion of your pancreas. So for a quick recap, your pancreas has both an exocrine function and an endocrine function. What the pancreas does is it secretes stuff. It's a big gland, but some of its secretions are exocrine secretions. Those are digestive chemicals that flow into your small intestine to help you digest food. But the pancreas also has an endocrine function, and there are other secreting cells in these structures called the islets of Langerhans, and it's the islets of Langerhans that produce your pancreatic hormones. So the islets are the endocrine portion of your pancreas, and they consist then of small clusters of cells that secrete hormones. So there are two types of cells in these islets. Okay, now islets basically mean tiny islands. So the cells then are either alpha cells, and these secrete the hormone glucagon, or beta cells, and these secrete the hormone called insulin. You may have heard of insulin. And both of these hormones then function in the control of carbohydrate metabolism. So in the breakdown and use of carbohydrates, I hope you remember, are your sugars, including but not limited to glucose and starches. So insulin. This affects glucose metabolism. And helps glucose to move into cells, so to go out of your bloodstream and into your cells, and it promotes the conversion then of glucose into glycogen. Let's just say, just to remind you, in your muscles and liver. So quick reminder, glycogen then is a storable form of glucose. Glucose, being a sugar, is water soluble. But basically, lots of glucose molecules that get linked together in long and branching chains forms the water insoluble molecule known as glycogen. So glycogen is stored to a small degree in your muscles and to a larger degree in your liver. And this is your source of blood sugar in between meals. Once you have digested whatever carbohydrates were in your last meal, there may be some time when you don't have any carbohydrates from a meal circulating in your bloodstream, but you still need blood glucose. And so at that point, your body will raid glycogen out of your muscles and out of your liver in order to then have glucose for your blood in order to have an adequate blood glucose level. So, as I said, it helps the glucose to move into cells, and it promotes the conversion of glucose into glycogen in the muscles and liver. And I'm going to add, and moving it into fat, which is to say in adipose tissue. So it helps to move glucose out of your bloodstream and put it someplace other than the bloodstream. Use it, put it into glycogen, put it into fat. It also increases the oxidation of glucose within the cell. So we're getting a more complete picture here. We have glucose, as I said, being taken out of the blood and being moved into cells, taken out of the blood and converted into glycogen, taken out of the blood and converted into adipose. What's more, the glucose that was put into the cells is being used at a higher rate when there is insulin around. So all this then helps to lower the levels of glucose in the blood. So that then is the hormone insulin. Now, the hormone glucagon. So the effects of glucagon then are usually antagonistic. To those of insulin. So, roughly speaking, glucagon, the overall effect of glucagon then, is that glucagon raises blood glucose levels where insulin lowers your blood glucose levels. So the disease known as diabetes and this is specifically diabetes mellitus. This then is when the islets of Langerhans fail to produce enough insulin. Therefore, blood glucose levels rise. And the excess sugar, remember glucose is a sugar, the excess sugar is secreted in the urine. That's why the old-fashioned test for diabetes mellitus was testing for sugar in the urine. So the symptoms then of diabetes mellitus are weight loss, thirst, all that extra sugar in your blood, and weakness. And if the diabetes is untreated, it will lead to death. But this problem is treatable then through diet, oral medication, and insulin. Now, in this case, when we're talking about the islets of Langerhans failing to produce enough insulin, that is type 1 diabetes. I'm now not talking about type 2 diabetes in terms of how a person winds up having it. The symptoms wind up being very similar. Same problems, same worrisome outcome, But one of the tricky parts about dealing with patients who have diabetes, or dealing just with friends or people you may see on the street who have diabetes, is that if they are using insulin, then it is too easy, and it's a problem. It is too easy to basically give yourself too much insulin. So peculiarly, even though the disease diabetes, if untreated, means that you have blood sugar levels that are far too high, because diabetics basically constantly have to guess what their blood sugar levels would be in the future if they didn't use any insulin, they then have to kind of guess at how much insulin they should use for, the next hour or two. So if they give themselves an injection, there may be problems because that may actually take too much glucose out of the blood. And peculiarly, diabetics can very often wind up having low blood sugar, not because that's a symptom of diabetes, but because that is a symptom of an overdose of insulin. And it's unfortunately easy to misjudge the amount of insulin that you need, give yourself a little too much, and then you can wind up having a low blood sugar episode, which unfortunately can also be deadly. So if you know someone who is a diabetic, you actually have to kind of ask when they last ate or have they given themselves insulin. And the usual rule of thumb is that if you do not know whether the person is feeling woozy because they have too high blood sugar or because they have too low blood sugar, the best thing to do is to err on the side of giving them a little sugar, giving them a glucose tablet or some applesauce or something like that. Because if they have too high blood sugar, that tiny amount of extra glucose is probably not going to make a huge difference. On the other hand, that can save the life of someone who is having a low blood sugar episode. But in any case, if someone does give themselves too much insulin and they wind up with too low blood sugar, the treatment for that is basically giving them some sugar. A glucose tablet, hard candy if they can be counted upon to not gag on it, frosting if they're a bit more compos mentis, applesauce or something like that. But as I said, it is a peculiarity and ironic peculiarity of diabetes mellitus that many people who have it, who use insulin because they need to, can wind up having episodes of too low blood sugar because they misjudged the amount of insulin that they need. And misjudging insulin is unfortunately an easy thing to do, so it's a relatively common problem. And that's it for this lecture.